Good day everyone, I'm John Allen M. Destajo and today I'm going to demonstrate health history taking and general survey. So in preparatory phase, first you're going to assess the medical record of your client or the patient. This is for you to know the past health history of the patient and to gather past infos. So next you are going to determine the scopes of assessment and prepare the equipments that are needed. So here I already prepared the equipments needed for vital signs. So next then you're going to apply hand washing. So here I prepared the alcohol rub for hand hygiene. Then next introduce yourself to the client and verify the client's identity. So good day, sir. My name is John Allen Ambistao and I'm your nurse for today. So may I please know your name, sir?
Alimar Onan, nurse.
How would you like me to address you, sir? Should I call you Alimar?
Yes,
Sir.
nurse.
So for today, I will be taking your health history. So in taking health history, this is to identify if the right patient is, if you're assessing the right patient. So it is for the it is to verify the client and build a trusting nurse-client relationship. So next, you are going to explain the procedure to the client. So before anything else, I would like you to know that taking your health history involves me asking you questions and you need to answer and it will be recorded. So, don't worry lang sir nga kay kaning mga information nga imong mga answer ato lang siya i-confidential so walay lain makahibalo ani. Will that be okay for you, sir?
Yes, nurse.
So, do you have any questions or concerns before we start?
No, nurse.
Then next is you're going to position patient comfortably and provides privacy. So, okay lang kasi imong giingkuran sir na relax lang ka diha, goods lang ka sir.
Yes, nurse.
So, shall we proceed to the interview?
Yes, nurse.
So, in assessment phase, determine the biographical data of the client. So, can I ask your full name again, sir?
Alimar Onahan,
Your birth date.
November 9, 2002.
So, your address and birthplace, sir.
The emergency hospital.
So, sa imong address, sir, imong address.
Rock o Nabuga.
Your religion.
Roman Catholic.
Civil status.
Single.
Occupation, sir, occupation. No occupation. So, unemployed. So, have you had any surgery before?
No, nurse.
Do you have any health plan or insurance?
No, nurse.
Okay, so the biographical data provides direct information related to the client or to the patient's current health condition. So alert the nurse to risk factors for health problems and point out the needs for referral. So next, mag-assess na punta sa Next, mag-assess ta sa reasons for seeking healthcare or the chief complaint of the patient. So, what brings you to the hospital today, sir? Ano may imong sakit nga nganong animang ka sa hospital?
Sore throat.
So, giubo ka o gi-sore throat. So, next, determine the history of present health concerns utilizing the cold spa. So, can you describe your cough? Is it dry or is there any presence of phlegm? Dry cough lang. So, when did it begin?
Last 3 days.
Okay. So, last 3 days. Does it hurt anywhere when you cough?
Ano, nurse, sakit lang.
Sa asa man dapit sa dughan or sa sa dughan. So, how frequent is it? Unsa man, usahay pirmi ba na siya, sir, or usahay lang?
Usahay lang.
Usahay lang. So, how much does it bother you? Is it severe or not?
Severe.
Severe siya. So, na ba kay ginatake nga mga medication karon, sir?
Naa.
So, unsa man, sir? Unsa nga herbal ba?
Herbal.
So, So, unsa man nga herbal?
Lagundi leaves.
Lagundi leaves. So, how does it affect your life and daily activities? Makapekto ba siya kanang samukan baka sa iya? Sa ubo mo, sir?
Samukan.
So lisod sige lang kag ubo, sir, no?
Yes, nurse.
So, next is you're going to determine the past health history of the patient. So, do you have any allergies?
No, nurse.
Previous medical diseases like diabetes,
No, nurse.
hypertension,
No, nurse.
anemia,
No, nurse.
fracture,
No, nurse.
isa pa man, sir, nabakay kuan ka ng nabakay frequent nga headache?
No, nurse.
So, have you recently undergone any surgical procedures or hospitalization?
No, nurse.
The rationale on asking these questions is to identify any health factors from the past which may have a direct relationship to the current condition of the patient. So, next is you're going to determine the family history of the patient. So, okay pa ba ang imong mga parents karon, sir? Are they alive and well? So, nakay mga igsuon, sir?
No.
Na ba sila heart disease,
No, nurse.
cancer,
No, nurse.
hypertension,
No, nurse.
diabetes,
No, nurse.
asthma,
No, nurse.
allergies,
No, nurse.
and ethnic origin?
No, nurse.
So, moving on into the review of system. So, first is you're going to determine the general health survey. So, first is we're going to take the vital signs such as temperature, blood pressure, and respiration of the patient, as well as the height and weight. So, karon, sir, mag vital signs tang lang ta, sir, ha? So, ako taka kuan thermometer para ma-check na to ang imong temperature. Kuan lang na nato sa imong cancer, ha? Sir, kuan lang So, nakay 36.1 degree nga temperature. Imong blood pressure, sir, mag-kaantat, sir, gamit sa sphygmomanometer. Mag-BP lang sa to, sir, ha? Pwede lang move diri nga corner, sir. So, sa kadali, sir, ha? Angat lang nato ni mo cancer imong kanina. I-relax lang nato atong kamot, sir. Dominant mo man imong cancer, walahon mo ka sa atohon mo ka, sir, no? Baliktad dito sir para magkuhan akong isulat ang imong result. So ang imong blood pressure imong blood pressure, sir, is 120/70. So, imong heart rate is... mag-check po ta sa imong heart rate, sir, ha? So, pwede iangat lang nato ang imong cancer para tuminaw na ko imong chest. Tapos, ginawa lang kaglalong, sir. Sige. Normal lang ang ginawa. So, nakay 80 beats per minute. Tapos, sige sir, ginhawa lang sir. Sa imong respiration. Sige, hinga lalim. Exhale. Inhale. Exhale. So, imong respiration is 28 per minute. So, next. Moving on to the integumentary. So, since we are done in the vital signs, the patient's vital sign temperature is 37 degrees Celsius. The blood pressure is 120/70. Then the heart rate is 80 per minute and respiration is 28 per minute. So, sir, do you have any skin diseases such as itching, rashes, scars,
No nurse.
sores,
No nurse.
ulcer,
No nurse.
warts,
No nurse.
and moles?
No nurse.
Na ba kay skin reaction kung init na kaayo or tugnaw na kaayo?
No nurse.
So, changes in hair texture. In shampooing na maapektuhan ba imong cancer? Magka-hair loss ba ka kung mag-shampoo ka?
No nurse.
So, changes in nails. Usual patterns of nail care. Kuan ba ka sa imong nails? Nakabutang og polish or acrylic?
No nurse.
Then, moving on to the head and neck. So, you are going to ask for headaches. So, na ba kay headache, sir?
No nurse.
Lumps,
No nurse.
scars.
No nurse.
Dili sa dapit sa imong cancer, sa imong head ug neck nato ni sir ha. So, na ba kay head trauma?
No nurse.
Recent injury or surgery?
No nurse.
Then, history of concussion or loss of consciousness?
No nurse.
So, wala ba kay dili ba ka makalipong usahay? Stiff neck. Pain with movement of head and neck. Okay lang mag-iyok-iyok kasi mong ulo. Swollen glands.
No nurse.
Nodes. Wala kay ka ng mga sakit diri sa kuan. Okay. Moving on to the eyes. Do you use glasses or contact lens?
No nurse.
When was your last eye examination?
Last month.
So, last month. So, June. So, na ba kay eye injury recently? Wala. Itching.
Wala nurse.
Tearing. Drainage.
No nurse.
Vision or parts of fields.
No nurse.
Blurred vision.
No nurse.
Double vision.
No nurse.
Colored lights.
No nurse.
Na ba kay recent eye surgery?
No nurse.
So, moving on to the ears. Sa ears na po ta, sir, ha? So, when was your last hearing test?
March.
So, March. February, March, April, May, June. So, last March. So, 3 months from now na. So, do you have any hearing difficulties?
No nurse.
Sensitivity to sounds?
No nurse.
Ear pain?
No nurse.
Drainage?
No nurse.
Ear infections?
No nurse.
Ringing?
No nurse.
Kanang magbagting-bagting, wala? Fullness in ears? Earwax problems?
No nurse.
Use of kanang cotton buds, nagamit yung cotton buds, no?
Yes.
So, naka-ear care habits. So, kanang mag-use of cotton tip swabs. Then, moving on to the nose and sinuses systems. Do you have pain over your sinuses sinuses cavities around nasal? Kanang dili dapit, sir? Sa passages? Na ba kay sinus ana dia, sir? Sakit sa yung area sa ilong nimo?
Yes nurse.
Do you experience nosebleeds?
No nurse.
Do you experience runny nose, sneezing, or any allergies in the nose? So, na kay runny nose, usahay, o kanang mag-atching-atching. Do you use recreational drugs or kanang difficulty breathing through your nose? Nagamit pa kag kanang mga Vicks, ana? Gamit ka na?
Yes.
So, how frequent man, sir? Every time nga mag-sneeze ka, magamit ka?
Yes.
Then, moving on to the mouth and throat. So, do you have any history of sore throats?
Yes nurse.
So, mo man ang imong complaint karon, sir, no, ang sore throat
Yes nurse.
kay tungod sa imong ubo. So, mouth sores,
No nurse.
sore throat again.
No nurse.
Bleeding gums,
No nurse.
changes in voice quality,
No nurse.
kanang napagaw ba ka recently? Or difficulty chewing or swallowing ka na, magsakit. So, since man sakit imong tilaok, so maglisod kag tulon.
Yes nurse.
Okay. Then, the next question sa changes in sense of taste. Yung panglasa, sir, naga-change ba? Makapanglasa gyapon ka, sir?
Yes nurse.
Dentures and bridges. Wala. Dental surgery.
No nurse.
So, when was your last dental examination? So, July. Naba kay dental hygiene patterns? So, kuan lang, toothbrush lang gid.
Yes nurse.
So, how frequent man? 3 times a day after meal. Very good. So, moving on to the respiratory system. So, the nurse should determine and ask for breathing patterns. So, since our patient is having cough, so I'm going to ask him some questions. So, do you have any experience of shortness of breath, sir? Kanang maglisod ka ginawa usahay?
Sometimes.
Sometimes. Did you had pneumonia before?
No nurse.
Tuberculosis?
No nurse.
When was your last chest x-ray and results? Last x-ray nimo, naka-x-ray ba ka or wala pa?
Wala pa.
So, healthy man pud ka, sir, no? So, wala lang, sir. And, naga-smoke ba ka, sir?
No nurse.
Okay. So, the rationale in asking these questions is to identify if there are any changes in respiratory. So, especially in smoking, so it really is a disadvantage, or it can cause lots of problems to the patient or to any individual if they continue to smoke. Then, moving on to the cardiovascular na punta, sir. So, cardiovascular system. So, had you encountered any heart problems like chest pain.
No, nurse.
Pero karon na namakay murag sakit man kay imong dughan. So karon lang sir for the last 3 days. So palpitations, uh, hypertension, murag ma-feel ba nimo nga high blood ka kanang sakit imong batok.
No, nurse.
So awakening at night nya maglisod og ginhawa like makamata lang ka sa tunga sa gabi tapos makalisod ang ginawa naka-experience na kana sometimes. Pero sa karon ra na sir nga kiubo ka. Then cold or numb hands and feet. Is your hands or feet kanang bugnaw sir? Numb ba siya or kanang bugnaw siya? Imong kamot? Sakto lang, okay lang. So swelling of extremities kanang palington bagid kag-ayo sir. Sometimes. Have you tried electrocardiogram? No.
No,
Okay. So assessment on the cardiovascular system determines factors that can influence cardiovascular health. So moving on to the breast. So magkuan lang gyapon maski lalaki pa sir kailangan gyapon nato i-assess kay fact ng ang lalaki dili lang ang babae mismo ang magka breast cancer, apil pud ang mga lalaki. So nakay ipang question sa imo sir ha. Is there any breast masses in your body sir?
no, nurse.
Lumps,
No, nurse.
pain,
No, nurse.
kaning dapit sa imo dere? Wala. Breast cancer, breast surgery, wala pa kana. So you haven't tried this one. So moving on to the gastrointestinal. So may I know your bowel pattern, sir? Is your stool soft lang sir kanang normal lang ba kanang hard enough lang siya? Di ang sa may color niya sir, yellow lang gyapon siya.
Yellow.
Tapos dili pud siya kuan sir. Kanang gahi lang siya sir, dili siya kanang pale. So next is genitourinary. So sa urinary bladder sir, nabakay kanang sakit sa imong pantog sir?
No, nurse.
Urinary frequency, how often do you pee sir kanang sa man permi baka mangihi or how many times a day lang ka nagaihi? Like, sahay lang.
Sahay lang.
Pero di ka naga-hold og kanang ihis nimo sir, imo lang i-release. Imo lang i-release tayo. So moving on to the male reproductive. When was your last testicular examination? Wala pa ka nakatry na ba ka ni sir? Wala pa. So do you perform testicular self-examination? No. So the rationale in this is to determine any problems and disorders related to the male genitalia, or since our patient is a male, so this is to determine the reproductive organs of the patient. So it is for us the nurse to know this kind of questions for the history of the patient. So moving on to the musculoskeletal. So you're going to ask if the client experienced any fractures, pains in the joints, muscle cramps. So these questions are asked. So have you had any joint swelling, sir?
No, nurse.
Limited range of motion, spinal deformities,
No, nurse.
loss of height,
No, nurse.
joint deformity.
No, nurse.
Okay. Very good. So, wala kay mga muscle pain, sir? No. Nothing. So, joint disease or rheumatoid arthritis?
No, nurse.
Sa imong family, walay nagka-arthritis ever since. Then, moving on to the neurological system. So, the nurse should ask for headaches or any neurological health conditions such as any mental disorders or in regards of the brain. So, have you had any headache recently, sir?
No, nurse.
Nausea or vomiting?
No, nurse.
Okay. Nagasakit ba imong ulo? Sometimes or wala?
Sometimes.
Pero murag sa unsa man sir, murag stress lang.
Oo, nurse.
Dala stress lang siya. Tapos moving on to the immune or hematologic. When was your last blood test? Wala na ka naga-blood test recently. So in developmental consideration, you are going to ask for current situations. You are going to ask for current significant physical and psychological changes or issues in client's late development stage. So at this point, you're in your life. So in assessing the client, it's important to consider their development stage to help determine the relationship between the patient's health status and the growth and development of the patient. So, moving on sa health practices and beliefs, do you get a yearly physical examination or seek health care only when ill?
No, nurse.
Kuan lang ka, so seek lang ka health care only kung masakit ka. So, do you perform self-examinations and other self-care measures?
No, nurse.
Then, is in regards of nutrition patterns, what do you usually eat during a typical day?
Vegetable.
So vegetables, do you like vegetables? So please tell me the kinds of foods you use, that you prefer, and how often do you eat these kinds of foods? So sa man yung mga vegetables yun, like yung ganahan yun. Kalabasa, ano pa man? Along, oh, okay. So how often do you eat throughout the day?
3 times a day.
3 times a day. So who does the cooking? Nganong ikaw man lang, sir?
Kaya ako lang isa.
Ay ka. So living solo lang di ka, sir? Okay. So moving on sa activity and exercise pattern, what is your daily pattern or physical activities?
Nurse, cardio.
Cardio, naga-exercise kag cardio. So, do you follow a regular exercise plan? Pero, what types of exercise do you do? Like, do you jog or naga-jogging ka daily? Pero since nga, giumo ka, so, murag na stop siya karon. Okay. Then, moving on to the sleep and rest. So, tell me about your sleeping patterns. Do you have trouble falling asleep or staying asleep?
No, nurse.
So, nagkaykuan ka ng, unsaban, ka ng, naglisod ba kag, lisod ba, o nagalisod ba kag, ka ng tulog or lisod kag mata? Kag tulog.
Tulog, nurse.
Kag tulog. Kaya nga naman na, sir.
Sa ako, igor, nurse.
Karon lang na ka murag naglisod kag kanang sleep kay tungod sa imong ubo. Okay. So personal habits, do you consume alcohol? Caffeinated drinks or smoking? Do you take over the counter drugs or vitamins and herbal supplements? Okay, nag-take ka vitamins. Then, in social supports, what do you do for fun and relaxation? Watching TV, ma-relax ka, talasan lang ng TV, sir. With whom do you socialize most frequently? Say mo ng friends. May mo ka, pinsa man imo gina-socialize pa. With whom do you socialize most frequently? Your family, your loved ones, or friends?
Friends and loved ones.
Friends and loved ones. So, are you involved in any community activities?
No nurse.
Okay. So, moving on to socioeconomic status, do you have any health insurance?
No nurse.
Dental insurance or a prescription plan?
No nurse.
Okay. Then, so hapit na ta sir ha? So, in relationships, who are you living with? You are living alone man pud ka sir no?
Yes, nurse.
Okay. Unsa man naga-rent lang ka sir or unsa?
Friend.
Rent lang, rent. So what is your relationship like with your spouse and children? So single, wala pa man ka single pa man ka sir, so wala pa kayo mga anak sir no?
Wala pa.
Oh, okay. So moving on to cultural influences. In terms of your culture, do you have any practices that may conflict the prescribed treatment plan? Dietary preferences that needs to be considered? None. Wala lang kayo mga nang kailangan niya isunod nga dietary
Wala.
based sa inyong culture. Then, in stress and coping patterns, have you been experiencing stress lately? How do you handle it?
Watching TV.
So, mag-relax lang gid ka sir, mag-chill lang ka sa by watching TV. To whom do you talk to whenever you're feeling upset?
One nurse.
Friends o friends lang ni more apil po sa inyong mga parents.
Friends.
Sa parents. Okay. Then moving on to the termination phase, you're going to review the information obtained during the interview. So, and discuss the findings to the client. So, after the interview, present to the client possible plans to resolve health conditions if present. So, I just wanna sum up everything, Sir Alimar. So, if you don't mind, don't hesitate to correct me if I am wrong. So, for the last 3 days, you had cough and sore throat. Tama ba, sir? And nothing makes it better but nagatake ka og lagundi. That did help a little bit. So nakatabang gyapon siya sir atong lagundi. So there is no presence of phlegm in the cough since dry cough man sir now, so walay phlegma. You had no fever, no unexplained weight loss, and your breathing is okay. Sa lang magsakit imong chest. So you just really want us to sort out your sore throat and your cough. Gusto lang ka na mo lang na among itabang pud sa imo. So is there anything else you want to add before we move on?
No nurse.
Wala kay mga pangutana, wala kay kanang lain pang sakit. So what we are going to do from here is I need to examine you to know what is going on with your sore throat and cough. So next is you're going to measure client's understanding of the plan and need for further teaching. So provide the client the opportunity to clarify and ask some questions if he is interested to know or if he is curious about his health condition. So, will that be okay? Do you have any queries or concerns pa, sir? Wala na. So, okay, sir, we are done with our interview. So, thank you for your time, sir, and I hope that we can help you in what you are feeling today or lately, which is you're having cough and sore throat. So, thank you, sir. Mahuman na ta sa atong interview. So, after interviewing your patient, perform hand hygiene and end the interview politely. So, you're going to be polite to your patient since he or she is being cooperative with the procedure. So I'm going to perform hand hygiene using alcohol-based hand rubs. And I'm going to document lastly, I'm going to document the findings, so, of the client's record. These findings will serve as a baseline for in providing an effective nursing care plan to the patient. So that's it, sir, para sa atong interview. Thank you for your time, and I hope you will be fine soon. So that's it for health history taking and general survey. I hope you learned something. Thank you and God bless.